If you have come to Sunrise Dental Clinic because your child has dental caries, then this is the video for you. Dental caries is formed when there's an imbalance in the mouth. The balance has to be struck between the oral hygiene routine, the diet that the child consumes, and the quality of their enamel or their oral environment. When there's a misbalance between any of these things, anything is a risk factor for your child, then that can mean that they will develop dental caries. Dental caries is a treatable disease, but it's also an avoidable disease. What does this mean? It means that if we can get the right balance of good oral hygiene and good diet alongside the quality of the enamel being good, then we can avoid dental caries. How do we achieve this? Please watch the oral hygiene and diet advice videos appropriate to your child's age to understand more. When your child has a cavity, it can be quite stressful for you and for them. Unfortunately, many of the cavities are not detected until they are quite advanced. The reason for this is that most dental cavities start in between the teeth, because that is the surface of the teeth that is not regularly cleaned, which is why we advocate flossing from a very young age. As soon as your child has teeth, introduce them to flossers. You can hear more about that in the oral hygiene advice videos. However, we can detect these holes in the teeth early on by taking dental x-rays. If this is an appropriate measure for you and your child, your dentist will let you know. By diagnosing caries early, it means that we can treat it with much more minimally invasive treatments. Minimally invasive treatments can be simply improving oral hygiene, introducing flossing, and painting on special fluoride varnish at 3 monthly intervals. The next level above this would be painting on something called SDF, silver diamond fluoride. Silver diamond fluoride is good for early caries lesions and it arrests them. It makes them stop their progression, and it means that your child should remain pain free and infection free as long as the other factors of diet and oral hygiene are also addressed. So, using SDF at intervals of 6 to 12 months can be beneficial for your child. The other benefit is that it is really easy to apply. It's simply a liquid. It doesn't require much cooperation from your child. The next line of treatment, if the caries is advanced, would be to seal the tooth. All of the scientific evidence shows that sealing the tooth will help to stop the progression of the caries and avoid any pain and infection. If the cavity is caught before it has progressed to the nerve of the tooth, then this is a possible treatment. How do we achieve this? Either through fillings or using stainless steel crowns. Fillings in children are very difficult because they require moisture control. White fillings need the tooth to be dry, they need the child to be extremely cooperative, and if it's in a cleansable surface, it might have a good prognosis. However, cavities in between the teeth are not very easy to seal using white fillings, which is why if we're looking for a longer term solution, if the child needs that tooth to be in their mouth for longer than a year or so, we might look towards placing stainless steel crowns. Stainless steel crowns are actually the gold standard in pediatric dental treatment. They seal the tooth entirely, which means that you can rest at night knowing that your child's teeth are not going to progress in their caries and you're not going to have any further issues from that tooth. Placement of stainless steel crowns is very easy. It does not require anesthetic. It does not require any drilling. Simply, an elastic band is placed in between the two teeth, either side of the tooth that needs to be covered, and this creates a little bit of space in between appointments. Once they come back in, these spacers or separators or elastic bands are removed, and a size of crown can be chosen, and this is seated directly onto the tooth without cutting anything away. By using this really minimally invasive treatment, it means your child will be comfortable and the tooth will be fully addressed without having to resort to any anesthetic or any drilling, which is what we aim to do with children. We want to keep their experience non-traumatic and ensure that they have a really good dental experience. For the front teeth, they may require fillings, which are white, but as I mentioned before, the front teeth are easier to keep clean and therefore the white fillings may be easier to maintain. If your child has a cavity in an adult tooth, another approach may be required, and this will be explained by your dentist.